Today we're going to talk about gum disease and heart disease. You know, what are the links for gum disease and how does it impact heart disease at all? And there's actually several mechanisms in which gum disease has been associated with heart disease. One, when patients have had a heart attacks and they've had bypass surgery, they've looked inside the arteries that they did the bypasses on, and they found the same bacteria that in these plaques around the heart that they found in the mouth in patients that had gum disease. So the same exact bacteria are somehow getting access through gum disease, and what happens is the bacteria grows underneath the gum. It leaks into your vascular system and your lymphatic system, and these bacteria float around inside your bloodstream and they land somewhere, and where they land they create inflammation, and that inflammation can trigger plaque formation. Another thing it can do, it can cause the blood vessels themselves to become inflamed. So think of a blood vessel as a hose, and when it gets inflamed, not only does the size of the hose swell a little bit, but the inside lumen of the hose gets smaller, gets more narrow. So gum disease can cause total body inflammation within the blood vessels, which can shrink down those lumens, raise your blood pressure, and raise your risk of heart attack and stroke. Additional ways that gum disease can impact that. Really, it has to do with your body's immune response to these bacteria. When bacteria causes inflammation, what they found is in the middle wall of the artery, you have plaque formations in patients that are starting to get blood vessels that have atherosclerosis in the middle wall. And when it becomes inflamed due to gum disease, this plaque in the middle of the wall starts to bubble up. And as it bubbles up, it can leak into the lumen of the blood vessel and lead to a plaque formation, a clot, which can lead to heart attack and stroke. So gum disease, the bacteria themselves have been associated with plaques around the hearts after bypass surgeries. They've been associated with creating inflammation, which causes the blood vessel lumens to get smaller, and it can cause the plaques inside the middle wall of blood vessels to become bubbly and leak into the lumens, which also can lead to heart attack and stroke. So those are common mechanisms by which gum disease can impact heart disease as well. Thank you much.